Hello, good afternoon. I'm Jaime Restrepo. I'm pediatric nephrologist from Cali, Colombia, South America. I want to share the experience for our Sister Renal Center program between the nephrology service from Boston Children's Hospital and Fundación Valle del Lili, Cali, Colombia. This program has been built in the southwest of Colombia, starting in 2007 in Cali, capital of the state of the Valle state. And then in 2014, this program spread to Popayán as a capital of Cauca state through a new program named Sister Renal Center Trio, which included the hospital Susana López de Valencia at Popayán. And finally, we built a new program, the Sister Transplant Center, dedicated to transplant exclusively, and it started in 2016. All these programs have been supported by International Society of Nephrology. And the goal of this program has been to set up a Sister Renal Center supported by International Society of Nephrology to open initiatives to strengthen the pediatric nephrology service between a developed country and a developing country. We focus on improving early detection and proper treatment of kidney disease in order to avoid or delay the progression to chronic kidney disease. The methodology that allows us to achieve these goals was first we created a very important outpatient kidney learning center. This center was supported by social workers, psychologists, dietitians, and pediatric nephrologists, and they have been supporting all the time the families and their children since the inception of the program. Second was the actively advertises and encourages the opportunities given by the International Society of Nephrology and on the different groups of the clinics as the people from pediatric intensive care unit, neonatal care unit, infectious diseases, transplant teams. All of them provided updates related with detection, prevention, and treatment innovation from renal diseases. We created all strategies to support this, like we did 16 continual medical education, 1 or 2 every year, with 32 international speakers coming from different renal services around the world, with an assistance of 120 to 150 in each continual medical education course. We received also 6 ambassadors visits by professors who stay for 1 or 2 weeks sharing their knowledge and experience in our clinic. We have 34 visits which were done to Children's Hospital of Boston and the Brigham Women's Hospital, most of them related to nephrology area, intensivists, nurses, pediatricians, fellows of pediatrics, nephrology, and they took this opportunity to advance in education and training for 1 or 2 months. During these 13 years of the program, we have had these achievements: implementation of educational support and training in the intensive care unit group. We got to improve the treatment of acute kidney injury, acute as the main cause of immortality in pediatric kidney diseases. We did retrospective evaluation of patients with this disease in intensive care units in both pediatric and neonatal, and also prospective assessment to detect it earlier as possible using new tools like P-Rifle during 2008 to 2011, and then using Cavigo, trying to decrease the high mortality exhibited at that time, almost 56%, and we got decreased it to 40% in these high complexity units. Also in this time, We created a myelodysplastic clinic. This is a very important and complex clinic where there is a multidisciplinary team, like urology, neurology, nephrology, orthopedics, in order to decrease the secondary effects of bladder dysfunction over the renal function. This task was possible with the great support from the urology and nephrology division teams at Boston Children's Hospital. Other program not less important for us was establish a transition program of adolescents with kidney transplantation in order to improve the adherence and treatment in this group where the high risk to lose the graft is increasing every day. The other was to set up a big database for congenital abnormalities of kidney and urinary tract detected in utero and the follow-up until adolescent period of age in terms to avoid or to halt the deterioration of renal function in this group of patients. The follow-up of the more common renal diseases like in pediatrics like nephrotic syndrome, lupus nephritis, and IgA nephropathy have been other challenge to treat this group of the patient. And finally, to advance in the continual medical education in nephrology among the southwest of our country, the introduction of a new sister renal center trio program through the Children's Hospital of Southwest of Colombia allow us to create a new very special pediatric nephrology service and a new transplant service at the main general hospital of this city, Hospital San Jose. At this hospital, there are 2 transplant surgeons, 2 pediatric nephrologists, 2 adult nephrologists, 1 pediatric intensivist, and 3 nurses, all of them supported by Fundación Valle del Lili Transplant Service. We are preparing to do the first kidney transplantation in the NETs. We have presented about 30 posters and 18 lectures at international and national conferences, and also we won 8 awards at national and international events for our work. These activities have produced 19 publications, 14 unpublished studies, and 6 studies in progress. The conclusion and final reports in our program is that International Society of Nephrology through the Sister Renal Centers program from support from Boston Children's Hospital has allowed us to work on the most important needs of the pediatric nephrology in our region. Based on these retrospective studies, we established the most frequent causes of acute and chronic renal disease and also made possible to design prospective studies on acute kidney injury, thinking in improving the renal replacement therapy and also the integral management of kidney disorders and set up a new services in accordance to the population needs. This is the whole world. Thank you very much.